Dr. Potarazu, the one thing we've learned about healthcare in this country is one size does not fit all. The more you try to bundle accounts together, bundle patients together, take away the individual relationship between the doctor and the patient, the worse healthcare gets.
No question about it. David, I don't know if you remember that episode of I Love Lucy where she works in the chocolate factory.
Oh, yeah, yeah.
The chocolates come down the path
eventually with all
and she stuffs her mouth. That's what's going to happen to doctors because as individuals start to flood the system because they get access to the system either through a public option or otherwise, the doctors are going to have to absorb that volume. So the traditional 7 minutes that your doctor spends with you is only going to be reduced. So there's only so much that they're going to be able to do within a finite number of time. Going to have to take care of more number of people, probably get paid less, as Dr. Siegel has said. And so ultimately the quality of care is compromised for sure. And it's not cookbook. You can't standardize the treatment for every single individual with diabetes, with every single individual with high blood pressure. Medicine is still an art, even though it's a science. And the insurance companies here are clearly going to stand to gain because no matter what, even with the public option, they're going to try to squeeze out money from the consumer, from the employers, so that they have to pay more, to pay less to the doctors because they're not going to be in a position to ultimately lose money. So in the end, I think you raise an important point that the insurance companies do need to be held accountable. And as I've said time and time again, let's squeeze them out.
So we don't want to be treated like automatons, like in some science fiction movie about the future where everybody's treated the same, because that's not the way human beings are. And as far as I can tell, this Pelosi bill goes closer to that science fiction model than it does to the old days when individuals were treated more individually.
Well, you know, and part of that starts from the fact that some researchers, and if you look at the work done at Dartmouth and others, have said that there are certain things that if you do repetitively, such as washing your hands before you actually examine a patient or before you actually go into the operating room, have a significant impact in terms of lowering the risk of infection. There are certain things that clearly, if you do in a repetitive process and checklists, can reduce the number of errors and improve cost. But you can't apply that to every aspect of medicine, and I think that's where they've gotten carried away to believe that that's applicable to everything that we do in medicine, which it simply is not.